Welcome guys. Now I'm going to teach you the inhaler technique by using AeroChamber. This is an AeroChamber and I have one more. This is another AeroChamber. Those colors are coded for different ages and the size of the child, and these are used to deliver inhalers to the children. It is important that you explain, because the children are not expert. They do not take your instructions very carefully, and they have their own attitude. So you need to teach them to the parents. Explain the parts of the AeroChamber to the parents and explain them how they have to deliver the medication when you are discharging any child with the history of asthma or any condition where you need to prescribe them the inhalers. Now, talking about the AeroChamber itself, it has three parts. This part has inlet where you can insert the inhaler I will show you, and the other part has a mouthpiece. If you look on the top, it has a little notch, and within the notch there is a little circular orange sticker. This is actually not the sticker, it is a valve that can move when the child breathes in and out. It has a valvular function to stop and start the oxygen or the air. Okay, now if you see on here, there is a little pointer just at the top where my finger is pointing. There is a little pointer on the inlet for inhaler, and on the opposite side at the mouthpiece you see the notch. This notch and the pointer, both of them should be in line so that you can use it appropriately. Knowing the right technique of using inhaler is very, very important for the effective delivery of the medication as well as effective treatment of asthma or any condition related to the lungs that require the use of inhalers. Now I'm going to show you the inhaler. This is an inhaler. You must have seen it before. It has two parts. This is a canister and this is a cover. Cover has a outlet for the medication to come out. And if you see the canister, it has a black strip that shows you the expiry date. Before you use it, make sure that you check the expiry and you shake it well to make sure that the drug is delivered to the child. Now I'm going to show you how to assemble it. Keeping this in your hand, after checking the expiry, insert this in line with the notch and the pointer so that it works appropriately. This is very self-explanatory. All the AeroChambers have the picture given on them as well. If there is any confusion, you can see how they are assembled and how they should be used. So after you've made the assembly, make sure that you show them to the parents how to deliver it, and if the child is in stress, if they can anticipate the child is going to develop an attack of asthma, ask them to make them comfortable and cuddle them, get them in their lap. If the child is distressed, get them in their lap and try to calm them down. I have a little baby sitting with me in here so that I can show you. Okay. Say for example, this is a child and you feel that the child is getting distressed. Get them in your lap and calm them down, cuddle them, shake it well, check the expiry, shake it well and assemble it in line with the notch for the nose and put it on the face of the baby or the child, and make sure that the tight seal has been made. How you can make sure that the tight seal has been made is by looking on the movement of the valve, because If the seal is not appropriate, this will not move. This valve that I showed you before on the top, it will start moving when the child has made the proper seal. After you made this, after you assembled, press it once and let the drug go inside. Count for 5 breaths by counting the movements of the valve on the top, and after that you take it away and wait for 5 minutes and repeat the procedure to give another shot of the nebulizer, of the inhaler. Again, keeping this in same position, make the tight seal and count for, press it once and count for 5 breaths. That's all about it. If the child does not get better within 10 to 15 minutes, and if there is no improvement after 2 doses of inhaler, call 999. If the child improves, then the child can be observed at home. Instructions should be clear. Ask the patient not to smoke if there is any smoker parent at home, not to smoke at home. Take history from the child, from the parents, about any new pet, any triggers that includes smoking, any new paint, new carpet, all those things. So this is all about it. Now, when you need to change, that's another important question the parents may ask. If you see any crack, then you need to change it. Or if the child grows bigger, this mouthpiece can become smaller, then go and see your GP so that they can review and recommend you the bigger size. And the other question that the parents may ask, when should I wash it? It depends how frequently using. Look at the color of the container. This should be clear. If you see any fog, if you see any change in the color, it should be washed, because otherwise any medication that you will press from here will stick to the wall of the AeroChamber and it will not go appropriately to the child. And this is all about AeroChamber. There are different colors depending upon the size of the child as well as their age. Thank you.